Good afternoon, everyone. Uh, to our esteemed guests, faculty members, and participants. I am Shivani Khandolkar, student of Masters of Public Health. It is my privilege to welcome you all to our valedictory session of Gyan program on health policy and system research methodology, organized by Department of Health Sciences, Savitribai Phule, Pune University. It is indeed a movement of pride and honor to have such esteemed dignitaries with us today. As we embark on this special occasion, let us take a moment to welcome our distinct guest to the stage. It is our utmost honor to welcome our esteemed chief guest, Professor Parag Karkar sir. Sir, we kindly invite you to join us on the stage. We are honored to welcome Shri Maulik Choksi sir, who brings years of invaluable experience in health policy and system research. Sir, we kindly invite you on the stage. Yes. Nextly, with great honor, I would like to invite Mukta ma'am on the stage. Also, Dr. Swati, please join us on the stage. With great respect, we also invite Dr. Solomon Sarvi sir, National Faculty of Gyan course. To begin with this auspicious event, I would like to invite Dr. Abhay Kudre sir to extend a warm welcome to our esteemed guests and participants.
Yes. Respected Honorable Pro VC sir, all renowned delegates, participants, and students. We are here today for the valedictory session of this GAN's 2-credit course on the health policy and systems research methodology and introduction. We have in this course 20 participants, and they are coming from renowned institutions in India. To name a few, All India Institute of Medical Sciences, New Delhi, National Institute of Epidemiology, Chennai, Manipal Academy of Higher Education, and University of Delhi, and our own Pune University students. Again, to reiterate, if we try to see what made us think about planning this course, it was our constant quest at the faculty level to adapt our department's teaching programs, both MSc and Master of Public Health. We are adapting ourselves to fast-changing landscape of National Education Policy 2020, and that is our main driving force. We already have a solid interdisciplinary approach inbuilt at our department with a history of last 31 years. We strive to further build this interdisciplinary spirit and our adaptability in changing situation, changing contexts. At the time of this session, we take this opportunity to thank our Pro VC sir for his constant support and valuable guidance to us at departmental level, which keep us going and allow us to undertake newer and newer initiatives at departmental levels. Thank you, sir, and the entire university administration. Over to you.
Thank you, sir, for this welcome and insightful introduction. Now, it is our honor to felicitate our esteemed guest. I invite Professor Parag Karkar sir to present a token of appreciation to Shri Maulik Choksi sir. Please give. No. Thank you, Gayatri. Now it is my honor to invite our esteemed guest, Shri Maulik Choksi sir, from Access Health International to deliver a keynote address on the topic of expert practitioners' perspective.
Thank you very much for having me here. I'll start from first, it's a fantastic program and building in young colleagues to get into health policy systems research is very, very important. And the reason I'm saying is I just share an example, a personal example that and a challenge that I'm facing right now. I have 6 vacancies in my office, and I've been struggling for past 3 months to hire people for those vacancies. And the reason behind is that we are not producing good quality people or human resources that could be absorbed as part of our system. And in that context, a program like GYAN is very, very important because it's trying to fill that gap. But obviously, when you start talking about filling that gap, it's a journey. When you say that you are a student and you want to become a practitioner, it's a journey that you need to go. And I believe that GYAN is the first stepping stone of that journey. You have just started realizing what health policy systems research mean, right? And if you want to be, and I'll share why I'm saying this. When I became a health system guy, I was not an Hpsr guy, I was a health system guy. My first job was to distribute that information booklet that you get, right? IC material, in a place which was a public place, and being very specific, the public urinal. I was standing in front of public urinal, identifying males with whom I used to spread information. I used to give that information booklet on HIV. And I'm talking about 2000. My salary was $7,000. At the same time, I was a researcher in the evening when I did my first public health research on masculinity and domestic violence. That was from 6:30 to 8:30. In the morning, post 8:30, I was a coordinator for care home for people living with HIV/AIDS. And I did that job till 12 o'clock at night. And I started my job from 6 to 9 in the morning. And after 9, I used to go and do all this job. So I was working for almost 18 hours a day. I worked for 3 years. But that 18 hours helped me leapfrogging 9 years. What people have attained in 3 years, attained in 9 years, I attained in 3 years. But that allowed me to be here where I am at the age of 50. So the point I'm trying to make is that if you want to dedicate yourself to Hpsr, initially it's not going to be a lucrative option. Let's be very honest on that. But if you are there and sustain for 5 years, there is no looking back. So then the question comes that from academics, how do I grow? Now, in my previous session, I explained that Hpsr is not only public health system. It's public and private health system. And when I start say public and private health system, the opportunities grows humongously. If you want to start being in the public health system, obviously there are internships offered by national think tanks like National Health System Resource Center, State Health System Resource Center. They have got 2 months internship. They want people with MPH. They have a selection process. Every year they will absorb around 10 to 15 students. You need to keep an eye on that if you want to get into research and policy framing domain. And a lot of interns then get converted into a full-time position. National Health System Resource Center. Niti Aayog. Niti Aayog has got young professional program where again they get interns and they get converted into professionals. Ministry of Health and Family Welfare. Now, over a period of time, most of our health departments or most of our departments are going with this mentality of investing in young professionals. And now, as we saw the interface, if you want to work on access to medicine, then you don't need to be kind of confined to Ministry of Health and Family Welfare. You can go to Ministry of Chemical and Fertilizer as well because they work for market development. How Indian pharmaceutical market will grow. You have got within Ministry of Chemical and Fertilizer, you have got also a medtech department which focus on getting innovative medical devices in our country, making sure that cost effectiveness analysis is done, and then they become part of health system. So when I was doing public health system, the horizon was very small, and we never knew about it. But now you guys have n number of opportunities to kind of go and explore yourself. But you can only land there when your foundations are there. If you know the nuances, at least academically, if you are able to converse academically, what health system means, how different facets of health system interact with each other, then there is no stopping. There would be limited resources available at a time. There would be struggle. But if you sustain for a period of time, it will grow up. I am not putting much emphasis on the development sector right now, because the development sector is donor financing, right? USAID, BMGF, they all have internship programs as well. But looking at the current kind of value proposition or current kind of turmoil in kind of global health diplomacy, I would not urge too much on looking on development sectors. But domestic sector, both public and private, are hotbeds, and they are looking for good talents. So if this, and I'm sure that, again, as I said earlier, that Gyan is first step towards that particular process. So based on that, if you start exploring yourself, and colleagues like us will always be there for you. If you need, reach out to us, and we'll help you to making sure that you are guided at the right time, at the right place. Thank you.
Thank you, sir, for this enlightening speech. Now we'll proceed further with the felicitation program. I would like to request Professor Parag Karkar sir and Dr. Abhay sir to start with the felicitation program. Yes. I'll request the participants, as I call, to please kindly come forward and take your certificates. Vivek Kumar, Preeti. Guys, please give a hand of applause. Shubham Babre, Shrishti Sinha, Rama Paranspe, Poresh Giripunje, Rama Paranspe. Siddhi Vasaikar, Sakshi Karvande, Dr. Ajay GV, Bhagyashree Radhakrishnan, Dr. Ashutosh Kothari, Mayuri Bhalekar, Gayatri Patil, Dr. Swanand Tirekar, Sakshi Chavan, Vaishnavi Karle, Dr. Smriti Vispute, Priyanka Gurik,
Okay, the last candidate is Shivani.
Thank you so much, sir. Now I would request Dr. Maulik sir to please felicitate our students for their appreciating work. I would now like to call Sanika Kude. These certificates are for to appreciate them for all the hard work and efforts they have put in organizing the whole 2 weeks course. Pratibha Naravde, Shrutika Tate, Ashwini Kamdi, Rutuja Dikle, Shraddha Borate, Gayatri Margu, Rupesh Penda, and lastly I like to call Sakshi Hirarkar for all, and thanks for all the efforts. Thank you, sir. Now I would like to call our chief guest, Professor Parag Karkar, sir. We still have pending certificates. I would like to call Abhay sir to carry with it.
Yes, thank you. At the valedictory session of this particular program, we would like to take this opportunity to give away our annual awards, okay, for our meritorious students here. So we have instituted Professor Padma Bhushan Professor P.V. Sukhatme Fellowship, okay, and 2 students every year receive this particular fellowship. This fellowship is facilitated by the kind support of Professor Bhushan Patwardhan to 2 students every year in our department. So this year, so yes, what we are going to do is that there are 4 students who got this particular fellowship in the year 23-24. So I would like to call upon stage Srishti Sinha to receive a certificate for this particular course. Please. Yes. You can take it. Okay. Unfortunately, second student is not here. Okay. But yes, this year's kind of fellows are Shivani Khandolkar, and Gayatri Patil. Thank you, sir. Thank you, everyone.
Thank you, Abhay sir. Now I would like to invite our chief guest, Professor Parag Karkar sir, Pro VC Savitribai Phule Pune University, to address this gathering.
Very good afternoon. This GYAN program on the theme Health Policy and System Research Methodology, an introduction, which was on physical mode for 2 weeks, ending today, and still week 3 is going to be online. So the program has a pause button, physical mode, pause, then we'll continue online mode. The participant from Pune University and other prestigious institute all over India, dignitaries on the dais, Abhay Kudale sir, Maulik Choksi sir, and other dignitaries. The guests who have delivered their sessions for these 2 weeks, and further 1 week you will be getting the knowledge. We have very less understanding about the public health system in India. For 141 million people, the healthcare system, public healthcare system is very, very poor. And private healthcare system has become a 5-star facility. There is a misproportion among the number of people, population, vis-a-vis the kind of bed or doctors available in this country. I'm not a student of medical science. But what I understand is multidisciplinary approach is required. Focus to create, maintain and sustain a system is required. Relevant policy has to be made and then continued all across the country. So equal opportunity, we call in simple words. And methodological approaches are required to be developed by the public health researchers. The outcome which I see is affordability, irrespective of your bank balance or insurance. Minimum level of healthcare should be affordable to every individual. Accessibility within specific distance from your home or native place, it should have basic health facilities available. equitable facility. It should not happen that only metro city has got very tall healthcare facility, and then when you go little ahead, we have seen in the base of Sinhagad Fort, if you see that we have done a survey with one hospital about the girls and females related to their health issues and then hemoglobin. On one side we have a Sinhagad Fort. If you go in the evening, you'll find all beautiful enlightened Pune ahead. On the left hand side you can see the Panchet water, but the woman in the house has to travel 1.5 kilometers to fetch drinking potable water. And lot of challenges related to health was faced. Everything is visibly seen but not accessible. And reliability of the system, it should not be driven by the markets. The World Health Organization is majorly funded by the pharmaceutical lobby. So whatever parameters of basic healthcare presented, blood sugar level, are dominated by the healthcare lobby. It should not happen. The basic healthcare can be driven by the health professional and not the, because if you, I have gone through the story in IIM Ahmedabad. The hospitals were running in losses when it was run by the doctors. And when the professional like business professional and IIM students and management students come into the picture, the hospital has started running in profits. So because our approach is business approach, our approach is a profitability approach, and your approach should be service approach. So I think we have to make that balance. I do not want that hospital should run in losses, but I think reasonability of things should be made available to students. We have good healthcare facilities available for the affordable people and not for non-affordable people. So I think this basic research which enables any state government, central government, all policymakers to take appropriate decision while making their policy. I think your outcome, your research, the GYAN program, all the professionals who are attending this will definitely help it out, because it has to be data driven, because the medical science now works on very extensive data, very reliable data. So I think you will help out in future to make very reliable long-term policies, creating a system for healthcare in this public healthcare, not healthcare only, public healthcare system. Because we have everything in paper, everything in place, but in not workable condition. You can't dare to enter a public health area or health outlet because the kind of surrounding and situations is there. Unsafe environment, I think that has to be made very reliable with the help of all this research. Research is very scientific approach. It cannot be driven by emotion. Most of the time I've seen in many of the field, emotionally attaching to the research get dilution of real research component in that, because we are emotionally driven into the research rather than rationally thinking about the do's and don'ts. Sometimes the researcher fails that this research outcome is not going to get any proper outcome. He want to make it something, because a clear research, which I have seen that after even 2 years, somebody has to leave the research because you are not getting the kind of data which is actually required to do the data. But in practical world, we drag the research the way we want it, and then the reliability of the outcome is under question. So I think by practicing, because health is most important component. So whatever you do in future, I think your conscience has to be clear that value-based, ethic-based research should be there. It should not be dominated by someone who sponsors that research to come with the outcome which is not useful for the people but for the marketeers. So I think I wish you all the best for your research. Keep your conscience clear, because we are talking about the public health, which is a large population. Official 142 crore, but unofficially the number is 160 crore people in this country, where some of the tribes we do not know as of today after completion of independence also. So I wish that your research should contribute something to the basic policy changes, basic sensitive changes in this. Then its program is successful. This is a starting 2 weeks and then 1 more week, but I think it will not end with getting the certificate you have got. I think it is a starting point. It start motivating you to do something in depth where you can get a good contribution in changing public policies in the country. India is a large country, diverse country, need very good policies and system in place to have reliable public health care. So I wish you all the best for your research, your patience, because physical sitting patience is going down day by day. So 2 years, Kudale sir and his team and all the stalwarts sitting on the dais kept you engaged, creatively engaged, properly engaged to work in a scientific way in scientific research of future. Thank you very much.
Thank you, sir, for your inspiring words and to support this initiative. As we have our PV Sukhatme scholar of last year here, I would request Parag sir to please felicitate her. Nikita Padtare. Thank you, sir. As we near the conclusion of this session, I would like to invite Dr. Girish Tillu, sir, to propose the vote of thanks.
Thank you. Thank you very much. This is 2 weeks. 2 weeks of hard work, 2 weeks of very interesting learning, and this is coming to an end, but not an end, as Professor Kalkar sir told us that this is just a pause button. But organizing this course was a very, very interesting but tedious exercise, the hard work. And first of all, we are very much thankful to the funding agency, the Ministry of Education, Government of India, and the GAN scheme for this particular opportunity and funding for this particular event. We are again very much grateful to the faculty, the Professor Karina Kilman from the Institute of Tropical Medicine, Antwerp, Belgium, who could spare her time, and she was here. She just left yesterday, and hence the contributing faculty, right? Just like visiting faculty, we also have visiting friends to our department. And Dr. Solomon Salve, he was very much instrumental and helpful in entire course, and we are very much thankful to you, Solomon sir. Thank you very much. Whatever we do here, that has a very graceful support and guidance from our university leadership. We are very much fortunate to have a great leadership who encourage us to do all such routine and crazy thing what we plan. And we are thankful to our Honorable Vice Chancellor, Professor Suresh Gosavi sir, who was here for the inaugural session, and Honorable Professor Professor Parag Kalkar sir, who is Pro Vice Chancellor, who is today with us. Sir, we are very much grateful to you. Our today's faculty was very interesting. These 3 lectures that we had, it was really an icing on the cake. And we are thankful to Dr. Choksi for Maulik Margadarshan and Dr. Gadgil for really a Mukta Chintan that you shared with us. And Dr. Swatiji, that was really a poetry, not just a talk, but you shared the journey with us. We are also thankful to our university administration, finance, management, administration department, and especially Professor Dr. Anupa Kumbhar ma'am, who coordinates all GAN courses from our university. And we are thankful to her. We are also thankful to the guests, to the faculty of our department, Dr. Aarti Nagarkar, Dr. Preeti Chavan Gautam, and our office staff. And most important, our participants. Friends, it is always said that adventures are dangerous. But there is also a saying that try routine, which is lethal. And you are the really an adventurous people who dared to spare 2 weeks of your dedicated busy schedule and try and test this particular course, and this was not a really entertainment. We know this was a hard work. Kalkar sir, these students, the participants, they used to start their work before 9:30, and they used to be here till late evening. And this was really a course that gave really hard work, passionate participants, and a great faculty who really introduced the happenings all over the globe. And we are extremely thankful to participants for your, dedication, passion, and courage to you came here. Hence, that was possible. We are also thankful to our students, our senior and junior students, for their continuous help. Now the formal vote of thanks really ends, but I should mention something for the person who was really instrumental to conduct this course. My friends, whenever we see beautiful garland, the thread is always not visible. I should tell about a person who was really instrumental, who conceptualized it, who worked hard from every pillar to the post and made it possible. Dr. Abhay Kudale, who is I'm sure the claps, they spoke everything, but he was the person behind this particular course, and we were observing and watching him, his hard work and the pains that he really could take. But sir, now today you are the very satisfied person, I'm sure. So thank you very much. Thank you for your participation, and I request you that we should, all the dignitaries and students, to visit the group work that was displayed on the board. This is the product of the course, and this course will not end. And Professor Choksi sir is here. Sir, the participants, they are going to prepare actually research projects, and these projects will be actually implemented, and such courses, they never end. It is just a new beginning. Thank you very much.
Thank you, sir. Once again, I want to thank all of y'all for being present here. We'll look forward to stay in touch and to meet all the participants during our online session from 17th to 19th of March 2025. Let us continue to work together towards strengthening health systems through research and collaboration. Lastly, I warmly invite all the dignitaries and the participants to join us for lunch, providing a great opportunity to network, interact, and exchange our ideas. Thank you.